one of the really nice opportunities for our residents here is to go out into a rural community, a smaller space, and work one-on-one with physicians who have been practicing in that community. It allows you to really put on the shoes of of a real family doc and see what family medicine can be at its most broad. We have residents go out for 2 weeks in their first year and then 4 weeks in their second year, 4 weeks in their third year to various places throughout the state and really have that immersive experience. It lets you try out your skill set. So things you thought you learned in residency, now go do. Be a part of that community. Try it on for size. See if it's a community that would fit you and your family.
There are many opportunities within the state to practice rural medicine, and if you don't get exposure to something during residency, it's less likely you'll go on to do that later. So they kind of build that in to help us know if that's something we want to do, and then just to get that kind of exposure to see what it really does look like, because it can be an intimidating thought to think that you'll be doing everything to care for a patient, and you might not have the backup of all the specialists that you would at a hospital, kind of like Nampa or even one of the ones in Boise. So it's good to get your feet wet, see what it looks like, and kind of build your confidence and think like, yeah, I could do this later on.
So rural medicine initially was not like part of my focus when I first started medical school. I grew up in a big city. But it's an area that I understand is quite underserved in the sense that, especially here in Idaho, there are not many physicians that are in rural locations, and certainly not many specialists. So a lot of really rural places will have family practitioners. They're not going to have pediatricians or obstetricians or other specialists in the area. And so not only is it an area where there's not many doctors per capita, but it's also an area where there's not just the same access to resources that you would have in a city.
So we find that residents gain so many things by going and working with our rural colleagues. They learn, a lot of times they learn a lot of confidence. There's something to be said for having a lot of supervision from your faculty, and there's also something to be said for going out and really doing the work.